Hi all, I am going to talk about the different steps involved in counseling. Counseling is the process by which a professional provides guidance and assistance meant to resolve psychological, social, and personal difficulties. The psychological therapy that the counselor provides to the client includes relationship therapy, cognitive behavioral therapy, and psychotherapy. Relational therapy, sometimes referred to as relational cultural therapy, is a therapeutic approach based on the idea that mutually satisfying relationships with others are necessary for one's emotional well being. People who are experiencing distress from their family, intimate, professional, or social relationships may benefit from relational therapy. This includes those who are experiencing mood disorders such as anxiety, depression, or stress that are causing relationship issues, and those who suffer from low self esteem, eating disorders, and poor body image. Next is cognitive behavioral therapy, CBT, is a talking therapy that can help you manage your problems by changing the way you think and behave. It's most commonly used to treat anxiety and depression, but can be useful for other mental and physical health problems. CBT is based on the concept that your thoughts, feelings, physical sensations, and actions are interconnected, and that negative thoughts and feelings can trap you in a vicious cycle. CBT aims to help you deal with overwhelming problems in a more positive way by breaking them down into smaller parts. In addition to depression or anxiety disorders, CBT can also help people with bipolar disorder, borderline personality disorder, eating disorders, obsessive compulsive disorders, panic disorders, phobias, post traumatic stress disorders, psychosis, schizophrenia, sleep problems, and problems related to alcohol misuse. Psychotherapy. Psychotherapy is a general term for treating mental health problems by talking with a psychiatrist, psychologist, or other mental health provider. During psychotherapy, you learn about your condition and your moods, feelings, thoughts, and behaviors. Psychotherapy or talk therapy is a way to help people with a broad variety of mental illness and emotional difficulties. Psychotherapy can help eliminate or control troubling symptoms so a person can function better and can increase well-being and healing. Now coming to our main topic, that is the different steps involved in the counseling, we can see that there are 4 stages involved in the counseling process. They are developing a relationship, making an informed assessment, establishing mutually agreed upon goals and objectives, developing an implementation plan. The first one, developing a relationship. In order to develop a positive helping relationship, you have to be able to connect with the person. That can happen only when they are made to feel like you genuinely care about their well-being and that you understand them completely. This requires genuineness, respect, and empathy on the part of the counselor. You need to create a safe environment where the client will feel comfortable to open up and talk freely. You also need to start things off by focusing on their strength. Second point is making an informed assessment. The first step in making an assessment is to find out if change is necessary, and if it is, the next step is to figure out what needs to change. Is it a behavior, an attitude, or a situation? A good assessment allows the client to see how his or her behavior or attitude might be contributing to an undesirable or unhealthy situation. Assessment is an ongoing process. Assessments are needed to ensure that you and your client are on the right track. In order to make an informed assessment about the client, you can gather information on the following way: talking with them, observing their behaviors and interactions, discussing with other people who are associated with them, reading any documented information about them. Then third point is establishing mutually agreed upon goals and objectives. Goals are broad statements that identify what you want to accomplish overall. Objectives are the measurable steps that you take to achieve your goals. Establishing mutually agreed upon goals and objectives is important because only if the client is actively involved in the goal setting process and is in agreement with the goals, he will be more likely to take ownership of the goal and follow through on them. Then the fourth point, implementation plan. The implementation plan is designed to prevent, intervene or address unhealthy behaviors and practices. Both the counselor and the client should work on it together. Implementation activities are designed to help individuals within their risky behavior work through problematic issues, address unhealthy lifestyle practices, learn new skills and build strengths. Implementation activities can include counseling, crisis intervention, training and education, supportive services, concrete services, and constructive use of free time. To conclude, we can say that each stage of the counseling process builds upon the former. While move through each stage, we will come to realize that it takes patience and practice to counsel effectively. If you are committed to the goal, you will do just fine. By expanding your knowledge base, gain more experience and strengthening your helping skills, you will become more effective counselor. Thank you all for listening to me.